Hello, my name is Mohamedin Gemalon, a nursing student from Notre Dame of Tacorong College of Nursing. So today I am going to demonstrate the assessing of your cardiovascular system. So the first procedure is assess the client's physical and psychological aspect before and during the examination. So rationale, it allows healthcare provider to gather and complete data to the client's health status. Hello sir, good morning. Kamusta po kayo? Okay, thank you. Okay. So the next is review the body areas of the examine. Then the rationale is help examiner identify which part of the body is to be examined systematically. So this part of the body we're going to assess. And the next one is make a physical and environmental preparation before the examination. So rationale, um, proper preparation of the environment, then client equipment ensures a smooth physical examination with a few interruptions. Okay. So the next is gather and take the health history of the client and inquire of any health diseases. So rationale, to have a comparison with previous illness and present health condition. Sir, nagkaroon na po ba kayo ng sakit sa puso dati? Okay, sa pamilya niyo po, meron po bang nagkaroon ng sakit sa puso? Inatake sa puso, meron po ba? Okay, thank you. Next is conduct a physical assessment of the abdomen. They are using the four skills assessment, which is inspection, palpation, percussion, and auscultation. Rationale, to assess and determine and identify abnormal findings, the cardiovascular system. Uh, and first is the assessment and inspection. Inspection the palpation of the heart. So simultaneously inspect and palpate the pericardium of uh, palpate the pericardium. Simultaneously inspect and palpate the pericardium for the presence of abnormal pulsations, abnormal pulsation for leaves or hips, and locate the valve area of the heart. For the normal findings, no palpations, no leaf or hip, and for the abnormal findings, pulsations noted diffuse leaf or hip and indicating enlarged or overactive right ventricle. Okay, so the first is what you are going to do is locate the sternum of the patient. Okay? Kung magpapalpate tayo, sir, magpapalpate ako dito ha. Okay? Kung may mafe-feel kayo na parang may bukol, okay, dito, so nandito yung sternum. Going to left side, okay, going to the left side, palpate tayo going to left side, ito yung aortic natin. Okay? Aortic. If palpate tayo, if ever na may mafe-feel kayo na malakas na pulso or malakas na pitik that is abnormal, okay, dapat mafe-feel kayo slight lang. Okay? Balik naman tayo doon sa sternum ng pasyente. Going to right, okay, dito naman yung pulmonic valve. Okay? Pulmonic valve, okay, 1, 2, okay. Ganun pa rin, palpate tayo. Kung may mafe-feel kayo na malalakas na pitik, okay, that's abnormal. Okay. From your pulmonic valve, okay, going down, magbibilang tayo ng 3, okay, to your tricuspid valve, okay? 1, 2, and 3, okay? This is your tricuspid valves. Okay, ganun pa rin, magpapalpate tayo, dapat may feel tayong slight lang. Kung if ever may feel tayo na malakas na pitik, that is abnormal. Okay, from your tricuspid valve, uh, pupunta naman tayo sa ating apical or mitral. So, bibilang tayo ng 5. 1, 2, 3, 4, and 5. Dapat dito tayo mag-end sa baba ng nipple line ng inyong pasyente. Okay? And this is your apical or mitral. So, ganun pa rin. Papalpate tayo. Kung may feel tayong malakas na pulso or pitik, that is abnormal. Okay. And the next is inspect and palpate the epigastric area of the base of the sternum and for the abdominal aortic aortic pulsations. For the normal findings, aortic pulsations, and for the abnormal findings, bounding or the abdominal pulsation. Example, the aortic and aneurysm. Okay. So, first is, kung magpapalpit tayo, dapat uh, i-locate muna natin yung epigastric area. Okay? Kung saan yung epigastric area, dapat doon tayo magpapalpate. Okay? Sa epigastric area, nandito siya sa gitna. Okay? Ang middle is yung umbilicus or umbilical cord, and doon sa pinakababa is your hypogastric. So, dito tayo magpapalpate sa epigastric ng pasyente. Sir, magpapalpate po ako. Okay? So, ganun pa rin, magpapalpate tayo. Dapat slight lang na pitik. Kung if ever may mag-feel kayo na malakas na pitik, that is abnormal. Okay. Next is the assessment of the auscultation. Auscultate the heart. Auscultate the heart in the 4 anatomic sites. So, the aortic, pulmonic, tricuspid, and apical or mitral. For the S1, usually heard at all the sites, then usually louder at apical area. For the S2, usually heard at all the sites, usually louder at the base of the heart. For the systole, silent interval and silent shorter duration. For the diastole, silent interval and silent longer duration. For the abnormal findings, increase or decrease intensity, verifying intensity with uh, verif- uh, verifying intensity with the different beats, or increase intensity of the aortic area and the increase of intensity of pulmonic area. Then sharp sounding and ejection clicks. Okay, now I am going to use my stethoscope. Okay? So, ganun, yung ginawa natin kanina na pagpapalpate dito sa aortic ng pasyente or aortic, pulmonic, and the tricuspid or mitral. So, ngayon is auscultate tayo. So, yung sa gitna is to locate the sternum first. Okay? Kung may feel kayong parang may bukol, so nandito yung sternum. Okay? So, going to the left side, nandito yung aortic natin. Okay? So, i-auscultate natin, dapat may maririnig tayong pitik na slight lang. If ever may marinig kayong ibang pitik, like ganon, so that is abnormal. Okay? Pupunta naman tayo sa pulmonic valve. Okay? So, going to the right. Okay? So, ganun pa rin. Auscultate tayo. Pag may feel tayong slight lang, that's normal. Pag may feel tayong ibang sounds, that is abnormal. Okay? From your pulmonic valve, pupunta naman tayo sa tricuspid valve. Okay? So, ganun pa rin. Mag-auscultate tayo. I-feel natin kung may marinig tayong ibang sound. From your tricuspid valve, going to mitral. Okay? So, andito yun siya sa below the nipple line of your patient. So, dito, okay? So dito yung maririnig natin na mas malakas na labdab, labdab, labdab. Okay? Kung may ibang sounds na maririnig, that's abnormal. The next is palpate the carotid artery. Palpate the carotid artery at one at a time. Then using a extreme caution. Then this is to ensure adequate and follow through the other artery to the brain. For the normal findings, um, symmetric pulse, the volumes, then full pulsations, and then the quantity remains same when client breathes. Then turns head and changes sitting to supine position, then elastic arterial wall. For the abnormal findings, symmetric volumes, then decreased pulsations, and decreased pulsation and thickening heart, then in elastic walls indicate the arteriosclerosis. So sir, bangon po tayo sir. Okay, harap po tayo doon. Okay. For the number 10 is for the auscultate the carotid artery. For the normal findings, no sounds heard on the auscultation. Then, for the normal findings, presence of bruit in one or both arteries. For suggestion, then exclusive artery decrease. Okay. So, pag mag-palpate tayo ng carotid artery, okay, meron tayong right and left. So, dapat ang face ni pasyente dito nakaharap. Okay? And then, palpate the carotid artery. Okay? And dapat, pag palpate tayo, slight lang, hindi pwedeng malakas. Baka magka-problema ang ating pasyente. So, pag may-feel tayong slight lang, okay, that's normal. Okay, same procedure in the left side. Okay, so palpate the carotid artery, ganun pa rin, palpate tayo. Okay, dapat slight lang na palpation. Okay, thank you sir. Next is the inspect the jugular veins at one at inspect the jugular veins at one at a time. So for the normal findings, veins are visible including rights of the sides, then heart functioning normally. For the normal findings, veins verbally distended and indicating advanced the cardiopulmonary disease. Okay. So then if a jugular distinction is present, so assess the jugular veins or pressure. Rational, the external with the jugular and more easily then affect the abstract conduction or thinking at the base of the neck. Okay? So, ganun pa rin. Okay? Ang dapat ang face ni pasyente dapat nandito. Okay? So, dapat, okay, dito natin inspect lang ha, hindi natin pwedeng i-palpate ang jugular vein ng pasyente. Kung may makikita kayo nagbukol-bukol dyan, that is abnormal. Okay? Same procedure in the left side. Dito pa rin dapat nakaharap si pasyente. So, inspect the jugular vein. So, nandito yan sa likod. Kung walang bukol-bukol, that's normal. Okay? And the next is the evaluation. Make findings of the health and assessment the physical and examination done for the client. Rationale, these are the important data and to convey to the physician and to diagnosis of the patients. Then for the documentation, record and report. Then report pertinent findings found during the assessment to appropriate personnel. For the rationale, to provide accurate data in the care of clients. So that's all for the assessment of your cardiovascular system.